Hey, my name is Alex, currently working as a hospital pharmacist in the UK. So what is a drug history? It's basically the process of obtaining an accurate list of all the medications that a patient takes on a regular basis before their admission to hospital. So what is the difference between drug history and medicines reconciliation? So a medicines reconciliation is basically making sure doctors are prescribing the patient's regular meds correctly, i.e. the medicines prescribed during their hospital stay corresponds to how they normally take it before they came into hospital. Medicines reconciliation also involves a clinical check, which basically means making sure all sorts of discrepancies are addressed and that all medications prescribed are clinically appropriate. A drug history, on the other hand, is a part of medicines reconciliation. It is a technical process whereby pharmacists, pharmacy technicians and pre-reg pharmacists can do. So it differs from medicines reconciliation as it does not require any clinical knowledge whatsoever. It's just all about being a detective and obtaining an accurate list of medications from various sources that a patient takes on a day-to-day basis. Just as a side note also, doctors will also do drug histories when patients are admitted to hospital, i.e. when they are clocking patients in. However, it's important that the pharmacy team also do their own version of drug history for the same patient, just as a way to provide that safety net and ensure any discrepancies are identified and fixed at the early point of their hospital stay. So when a patient comes into hospital, these drug histories should be done as early as possible alongside that medicines reconciliation. Everyone has their own little methods to do a drug history. Most hospitals would use a minimum of 2 sources of information for their drug history. So the more sources of information you use, the better it is. However, you have to take into account of how much time you actually have. You might have a busy day ahead with lots of patients to see, so you have to be logical about the time you want to invest for each patient. So that's it for part 1 of this video. Please move on to part 2, where I'll be discussing about what kind of questions you might want to ask to a patient when you're doing that drug history. Please check it out. Thanks for watching, and make sure you subscribe if you want to watch part 2. Thanks.